I,
Sorry about that.
okay,
Go ahead.
that was anything.
Yeah, well, we record them, so.
Okay, so it's, there we go. Had to get rid of that. So I'm a chiropractor. I also have a PhD in nutritional sciences. I've been in practice about 43 years come this December, I think. Long enough that I should have learned something, I suppose. I think that it's been an interesting journey. I talked somewhat about the early days last time, I think. I think you might agree. You don't have to agree with anything I say. That's fine. I'll try not to, I don't want to alienate anybody or offend anyone. I apologize beforehand if I do. I'm a little bit frank, but it's just what I've learned just from my practice. I've seen, I don't know how many tens of thousands of patients I've seen, and I've seen just about every condition I think there is. And I obviously treating patients for knee problems or back problems or headaches or whatever it is that I treat them chiropractically. Usually it used to be, it was a lot easier to do that. I think because maybe the quality of food was better. The stresses maybe were better, I don't know. But I think today the majority of the population of America is, is metabolically unhealthy. So when a patient comes in, sometimes they come in for a structural problem, but we usually always work into something else. I had one the other day, for example. He came in and had a bad back, and I treated him about 3 times, and he confided in me on the 4th visit. He says, Doc, I don't think you're helping me at all. I says, well, you are 400 pounds. So that makes it a little difficult for me to help you. So if you really want to make a change in your life, we're going to have to look at your diet. So that's kind of how that worked into my interest in nutrition. And it's just interesting how I see things that evolved through the years. When I was younger, we had even a couple of itinerant physicians that used to come and make house calls once in a while. And it was, they were very respected, good guys. They used a lot of, am I still on?
Mm-hmm. Yes, you're still on. Yes, okay, you're still on.
The screen keeps changing, so I just won't look at it. We had a couple of doctors that would come make house calls, and we had some. They were good guys, and they were very science based. If you found that this helped that, they continued to use that, and that's what I would call autodidact, if you will. Someone that's had experience. It just helps to have experience versus following a guideline that someone else puts out there. So I think that there's a reason why, you read the history of this planet, and kings were always very popular. And I tried to figure out what that was. And I think it's because it just removes responsibility. At least that's one of the big reasons. It just removes responsibility. So it's easier to have somebody tell me what to do than for me to think for myself. And that's kind of what I see as happened kind of in the healthcare world, that used to be very science-based, and then it started to move more into the evidence-based world, that instead of making decisions based on experience, it was easier, it was popular actually at the time, back in the early 90s, I think it was, when evidence kind of replaced scientific, and there were really expert panels that were formed and corporations funded it, and they would come up with guidelines so that instead of me having to think about a condition, I could go to the guidelines that would tell me exactly what to do. And I think that's where the error happened. And if you allow that to happen very long, then pretty soon it kind of controls your life. And there's not probably many doctors now that even bill for their own services. They have some other business doing it for them. But that kind of takes the power out of the physician, in my opinion, and the ability to really make a difference. I think the patient-doctor interaction is very, very helpful, very important in the outcome of a patient. And I think it's the starting of the healing process. And I think a lot of that has been lost as well. My wife took her mother in to see the doctor, and he never even looked at her. He turned to his computer, opened the computer, asked her a few questions, clicked on her medications, made a couple of changes, and then sent her on her way. And she was not very happy about that kind of healthcare, and I don't blame her. And I think that we need to get back to that interaction and using that intuition that we have, that the good Lord has given us. So, I think of even Moses taking the Israelites, he took 3 million Israelites out of Egyptian bondage, and it should have been a 2.5-week journey to Canaan. And he told them if they'd go with him up on the mountain, they'd learn a whole lot of stuff that he was learning. They said, no, you go up there and find out. We'll just let you tell us what to do. And that's why they had to hang around for 40 years. He never could teach them. And that's unfortunately the popularity of losing responsibility of making your own decisions. So I'm kind of encouraged because I see a lot of really good movement among healthcare. Those that have kind of taken the reins again and are starting to treat with those skills that I think were given to us by God. And I really think that any person, any physician really, regardless of specialty, that is living a good life, an honest life, and is not motivated by wealth or something else, is going to be a very successful physician, because it entitles you to a intuition that otherwise is not available. And I think we have thoughts that come to us. We need to pay attention to those, because that's what I think. I think it's the intuition that's given to us by our Creator. I remember one time I was treating a patient, had severe allergies to just about everything she was eating and drinking. And a thought came into my mind how to correct that. And without getting into too much detail, I used a very high cell resonant mineral and actually put it right on GV20. It's governing vessel 20, which will turn every acupuncture meridian on. And then I used a laser to laser the frequency of that food into an acupuncture point, and it completely cleared all those allergies. So I don't really think that we come up with that on our own, but whatever world we're in or we're contemplating, I think we're entitled to some of that inspiration. So the unfortunate panel of experts ended up, in my opinion, tainting the research. And that's where, and it was just mentioned here, the difference in absolute and relative research. I think the first big one they did was on Lipitor, where they, if I remember right, it was Dr. Brownstein that was telling that. And he said they had about 300, two groups of about 300. One used Lipitor, one did not. At the end of 3 years, if I remember it correctly, it's been a while since I talked to him, but there were two that died of heart disease, and one group that did not take it, and the ones that took Lipitor, there was only one, so they called it a 50% reduction in heart disease. And that was printed in the New York Times, and of course became a success. And unfortunately, people that are waking up and they're just sick and tired of being sick and tired. They don't really know where to go, because what they've been bombarded with really is this evidence-based tainted research. I love PubMed. I read PubMed, some of the best research out there, but to read the paper or the news is kind of a waste of time. I used to tell my kids, whatever you read or hear, just do the opposite, and you'll probably be healthier. Because I think it was even said that 5 out of 6 scientists proved that Russian roulette was actually safe and effective. So anyway, we have to know what we're looking at when we look at research. And certainly when we apply that to experience, that's where it becomes very, very important. So when patients come in knowing that their disease is really a result of poor diet and lifestyle, we have to start talking about what really works and what really doesn't, based on my own experience and based on really good research, because there is a lot of good research out there. And I just like to see courage and truth. It's inspiring to me, and it'll triumph. And I'm looking forward to that. So when we talk about sun or water or salt or fat, pretty well they've got it all backwards as far as the world is concerned, or the government, or whatever you want to call it, whatever's being printed out there. And it's just not anything that works. You can't trust it. And unfortunately, it's like a lady the other day, I asked if she was constipated, and she said, no, she takes a laxative. It's just the inability to understand the process. And so we have to take our time and start to talk to them about just basic lifestyle. That, salt is good. You need to hydrate. When I was taking undergraduate physiology, I remember they had a big article on the front door when I walked in the room. It was there for a long time. And it was an article about a woman who drank 8 gallons of water and it killed her. The conclusion of that was be careful and not overhydrate. And yet you read a book like The Body's Many Cries for Water by Dr. Blvd, and he says, you know, that 98% of the world is dehydrated. So it's just crazy that we take that opposite side. When I was taking genetics, I remember he was talking about how sugar and honey is identical. And chemically glucose, I guess, is, but there's very little relationship between the two. And yet that's what's being taught and I guess indoctrinated. So when you get out in the real world, you have to figure out that, you know, everything that's being taught is not necessarily true, even though you pay a lot of money to find that out. So fat is essential. And when the Lipitor became popular and they started blocking the pathway in the liver, they were also blocking the pathway of all the sex hormones, of cortisol, of the steroids. Vitamin D3 could not be activated with that pathway, poisoned really, and CoQ10, which really is kind of a shame that you'd want to block that. The healthy fats were very good. I remember when Dr. Schwartzbein, an endocrinologist, she said that she was put in a diabetic clinic. Her specialty was thyroid, I think, if I remember right. She wrote a book on it, but she said I was going to determine how to change these type 2 diabetics. And she drew blood, she said 7 times a day to figure this out because they were following guidelines and they were still losing eyes and legs and were dying with heart disease. And she said, I discovered when I gave them their fat back, that's what cured them. So she wrote a book on that called The Schwartzbein Principle. And I was very intrigued with that. And of course, type 2 diabetes is not that difficult to reverse if the person just has a little bit of determination, a little bit of discipline. Some are not interested. And to approach a person like that and just say, we're going to give you insulin rather than take your sugar away, to me is really a poor approach to healthcare. And I don't think that's the best way to go. So there are some really, really good doctors out there that are standing out. They're really doing a great job. I became acquainted with quite a few. I traveled the world around. I was introduced to a lot of different approaches to health, and I was not opposed to anything. I mean, I stand on my head in the corner of my office if I thought it would improve the health of the patient. And so I became aware of studies like Fritz Popp, for example. Fritz Popp is a physicist out of Germany. I really enjoyed his work because he was showing that every cell is really a tuning fork. He called it a crystalline matrix, and it vibrated at a certain frequency, and it continued to vibrate. And it was vibrated. It was light that was causing it to vibrate. And in fact, there was another doctor, Dr. G. I can't even say his name. He's got a long name, but he was able to photograph that. I saw that demonstration. It's very interesting. He had to take like 1 trillion frames per second, but one cell talking to another, just using this little shaft of light. In fact, one thing he said, this is Dr. Fritz Popp, he said, we know today that man essentially is a being of light, and the modern science of photobiology is presently proving this. In terms of healing, the implications are immense. We now know, for example, that quanta of light can initiate or arrest cascade-like reactions in the cells, and that genetic cellular damage can be virtually repaired within hours by faint beams of light. We are still on the threshold of fully understanding the complex relationship between light and life, but we can now say emphatically that the function of our entire metabolism is dependent on light. Of course, Einstein, he made a comment, he says, everything is energy, and that's all there is to it. Match the frequency of the reality you want, and you cannot help but get that reality. It can be no other way. This is not philosophy, this is physics. So if you're in Tibet, you know, they use Tibetan bowls. That's how they increase cell resonance of a particular organ. If you know what frequency that the hepatocyte rings at, you can take that frequency and ring it, and the adjacent tissue will become cell resonant and actually mimic the frequency. That was very interesting, and I've seen a lot of different approaches that way. It's been very interesting. Kirlian photography is fun to watch because they're photographing the actual process. When you're looking at a fractured bone, for example, you know, you can photograph that and you'll see the the little energy on the outside of the skin. Some people call that aura. Some people claim they can see it. And where it comes to the fracture, then there's just a black spot. They call it an interference field. And if you watch it, it will heal. If it runs out, say you run out of nutrition or the ability to heal, then it'll stop. And that's called a toxic focal point. And we use mud packs and so forth to restore that. Mud packs are interesting. I've used a lot of different mud packs. It's not the mud in your backyard. It's a very cell resonant mud pack we mix it with a liquid catalyst. And you can make incredible changes in areas that don't heal because they've collected debris for so long. You take a C-section, for example. You take a trauma side, a concussion or something like that. We've used them for years. They're very effective if you can just give the person the nutrients that they need. I had one, I don't know if I mentioned this one or not. She was a mail carrier here in town, and she was bit by a brown recluse on her leg, and she called from the hospital after 3 days. They'd used antibiotics IV on her, and they just said, "We can't save your leg. We're gonna have to take the leg off." That's when she called me. And I says, "Well, don't go to that extreme. Let's just," so we mixed a mud pack and we put that mud pack in, and it was pretty aggressive. Her whole thigh was purple, and flesh was literally falling off her leg. It was below the knee. And I took before and after pictures on it, but she says, I could tell after 2 mud packs, it was going to heal it. And it took 8 mud packs in about 3 weeks, and she was back to work again. So this is really strong medicine. This is nothing I came up with. I just ran into it. Some of these healers have been doing this for a long time. So we try to improve their lifestyle. So we talk about just basic things to start with because they don't even know how to breathe. So teaching a person how to breathe is very important. Breathing properly, 2/3 of our body's waste is exhaled. And if you don't know how to breathe in through the nose and out through the mouth, in fact, when you get a person that is having panic attacks, not only is that, catecholamine rush that comes from adrenal exhaustion, but you can stop it just by showing them how to breathe properly, because it's stored, that frequency is stored in the diaphragm. And if you teach them how to breathe with their abdomen, which little kids know how to do, but adults don't, they never do. They'll breathe with the chest all day long. So we have to stop them and show them how to lay them right down on the table and show them how to breathe properly. And that's an exercise they do every day. Grounding, sunshine. We came from the dirt, we're going to go back to the dirt. And so if we can touch Mother Earth, the Earth produces negative ions. There's a lot of research on this. And really, we're producing positive ions. That's the process of disease. And just by touching the earth, you get this massive electron exchange. It's probably the best antidepressant there is going out in the sun and putting your bare feet on the grass. But we've been taught that, sunshine is bad for us, and it's unfortunate. We've been taught that salt is bad for us. And I will agree, a refined salt, heated refined salt is bad for us. And I never recommend that. It's always unrefined. If it rains, it shouldn't pour unless you shake it a little bit. And any kind of, the average adult needs about 1.5 teaspoons of salt just for the adrenals to function, the middlechlorocoids. So if you take a little kid running around sweating outside, eating sugar, and he gets asthma, you put a little salt on his hand, have him lick it off, and it's almost an instant cure. The adrenals need a lot of salt. So those kinds of things people don't understand. So we just teach them how to do the simple things that are really quite free. We have them check their first morning pH, urine pH should be between 6.4 and 7.0 if their battery is recharged and they've got adequate ATP, and they're getting rid of the metabolic waste during the night. So it's just a cheap, easy way to do. So we have them do sunshine, we have them increase their water and their fat intake, quality fat. When I think it was about 1951, if I remember, was it? And yes, it was a study done by, what was his name? Ansel Keys? Anyway, whoever did the study said that one country that ate the highest amount of saturated fat had the highest heart disease, but there was 8 other countries that had just the opposite. So obviously there was an agenda there. They convinced President Eisenhower to follow that low fat. In other words, switching to seed oils, the linolenic acid seeds, which are all pro-inflammatory, the PUFAs. And then he died of heart disease. So That wasn't, of course, he was smoking 4 packs of cigarettes a day too, though. So back in 1951, that was not considered bad. But going to plastic fats is a big problem. And we have to get back to the good quality fats that's been used for so long. Now, in the case of animal fats, I think as long as the animal's clean, it's going to be good fat. If it's a grass-fed animal, it's great. If it's corn-fed and put in a calf or contained animal feeding operation, that's not what I recommend. But you know, whether it's coconut, whether it's butter, whether it's olive oil, you know, avocado, any of those are all healthy oils. And most people are fat deficient. So when I bring someone in, we go through questionnaire and just see where their major concern is, assure them that there's good things the body can do if we give it a half a chance. And then we usually run blood work. So blood work is unfortunately not real science-based, in my opinion. It's average-based. And so if they run 10,000 people through a laboratory and look at levels of, we'll say, vitamin D3, that's just based on averages, and then they give them 4 standard deviations, which is really unfortunate because that's really not what we're looking for. We want to make it very functional. There's no such thing as you know, a partial diabetic. You know, say you're borderline diabetic, come back in a year. Well, that's like borderline pregnancy to me. There's no such thing. Dysglycemia is dysglycemia. Insulin resistance, metabolic syndrome, all the things that come from excess amounts of sugars, which they had to put in when they took the fat out because fat was satisfying. So to satisfy, they just fill them with sugar. And then seed oils, which they somehow thought that would not cause heart disease, which is just the opposite. So we look at functional levels on our blood tests. We do very thorough blood tests. And you start to develop and see these patterns that develop with different conditions. And I would say the average person that comes in with a blood test that is, if we're looking at digestion, which is usually where I start, because the gut is where it all starts, in my opinion, we see about, I would say the average person is functioning at about 10% gut function. So the zonulin gap is very large. We look at actomyosin, zonulin, occludenin, and that gives us an idea. And it's about 10% is what you see. So as people start to, we take away the foods that cause the inflammation in the bowel. We take away all the fake foods, of course. And of course, the gut needs a lot of fat. You know, it's lined with fat. Those enterocytes are fat. So we have to help them in quality fats. And it takes them a little bit to understand that. But as they start to bring in foods that are slow to digest, foods that turn to sugar slowly, more of a Mediterranean approach, they get better. And no matter what the condition is, they start to show improvement. I would say if looking at, since the liver's primary job, if I was to summarize it, is to keep the bowel from becoming non-toxic. And when the liver goes down, the kidney starts to take the slack. I would say if I run blood tests on 10 people, 9 of them have a suboptimal liver function. So the next thing we have to do is we have to start to help the liver become more functional. And it turns over the cells very fast. It's been said you can get a new liver every 90 days. I don't know if that's true or not, but it does respond very fast. The enterocyte in the bowel, small bowel, turns over every day. So you can make good progress if they'll just start making some proper changes in their diet. Nutrients are tough because most of the nutrients out there that I test don't work very well. They've used poor quality ingredients, and they've either used too much heat in the process. Tablets I never use because they have to use a hydraulic press to put it together, and just the heat it generates reduces the nutrient value. But there's a difference in first crop hay and fourth crop hay, so we always use first crop and put it together carefully, and always in powders or capsules, sometimes liquids. There are good quality foods out there if you search, but it's kind of hard to do. And it makes it, the nutrients have to be food. And it is a supplement. It supplements how we eat. So you can't just keep eating what you're eating and take a supplement. It doesn't help much. But you get a good nutrient-dense supplement that has not got any toxic tag-alongs, gums, glues, binders, fillers that we see all the time. I don't like those. They definitely make the product less effective. So all I do is clean. It's hard to do. And it's extra hard to do when you get the ingredients and then try to put them together and to make sure there's no antagonism, but they each one ingredient should enhance the other. And that's probably the hardest part of putting it together. Once you source the ingredients and start putting them together, you find out you've got Democrats and Republicans in the same capsule. So you have to be careful with that, because that will make it so it doesn't work very well. And that's been the hardest part of doing this. And I've only put together probably 20 different products, which is probably all I'll do. I just kind of focused on the things I couldn't get that I felt like were not working. I mean, research will say you take this and it helps that, but I don't like taking this for that. That's not really, I'd rather look at what we call superfoods, things that kind of fill the gaps in and allow them then to improve as they're changing their diet and their lifestyle. So exercise, the Pilgrims didn't run unless they were being chased by a grizzly bear. So I still think that a good brisk walk is just as good as any exercise out there. It's just looking at people with longevity. I don't see many runners that have very good longevity, but I still get a lot of people ready for the Boston and that sort of thing. But it's just, if they'll just get a brisk walk and learn how to breathe properly, improve their diet, it makes a huge difference. Huge difference. So the three things we look at basically is the things I assess is structure. That's the chiropractic end of what I do. I just believe that the nervous system has got to talk to everything, and if there's any kind of compromise, we have to release that. So you can't stand on a hose and try to water the garden. So that's where the chiropractic comes in. I do a lot of sports injuries and a lot of things like that. That's a little bit boring to me, but I just do it anyway. And so I see a lot of ankles and knees. And I taught a course on feet, so I've done a lot of orthotics, and 80% of knee and hip replacements are definitely foot problems. So you can just tell by the way people walk. If they're overpronating and those external rotators have to work all day long, you're going to wear a hip out. So if you can fix the feet, it makes a big difference. So we do structure. We bring in nutrition if people are interested, or if they're not getting better, if their inflammatories are too high, they want to know why they're so inflamed, then we just have to address that. I do a lot of blood work, do a lot of, and the third thing really is the stresses of life. And we just have some simple ways of helping that become less. And I see lots of anxiety and panic attacks. And like I said, a lot of that is just adrenal exhaustion and improper breathing. So when you put that together, they do lots better. So I don't know how far you want me to go into this. I'm happy to entertain any questions if you have an interest in a certain area or a certain direction you want me to go here, because I can go too long in too many directions here because I'm kind of harebrained. But anyway, that's what I do.
I would like to know something.
Yes.
You mentioned the photobiology, and you mentioned a German man, Fritz something, and I could not understand the last name.
Yeah, P-O-P-P.
Was it Pop? Fritz Pop?
Yes, Fritz Albert Popp, P-O-P-P.
Okay, thank you.
You bet. He's a brilliant man. He's fun to read because he has done a good job. It says 1970, Dr. Fritz Popp, PhD, a German physicist, Nobel Prize nominee, discovered that every cell has a semi-crystalline matrix that emits light or frequency vibrations. Dr. Popp proved that light or frequency vibration, proved that if you use UV light to destroy 99% of a cell, including its DNA, you can almost entirely repair the damage in as little as 24 hours just by illuminating the cell with the same wavelength at a much greater intensity. This process is come to be known as photo repair. And in 2010, a Russian biophysicist, and that's the molecular biologist, I said I can't say his name, starts with a G, G-A-R-J-A-J-E-V, successfully intercepted communication from a DNA molecule in the form of ultraviolet photons, or in other words, light. His experiment was based on the biophoton work of Dr. Popp. So I just like his work. It's very interesting to see how you can change frequency. I have machines that I can test frequency on different tissues. It's fascinating. It really comes down to the notes on the piano from middle C to the C below middle C. And that's where the Tibetan bowls come from. I learned that from Dr. Gaynor, and he's an oncologist, but he said when he introduced the Tibetan bowls and treated with those, his success was tenfold. So it's fun to do that because you can, if you know what frequency each tissue is, you can enhance that frequency by a multiple form of, you can do it with sound, you can do it with light, so light, Royal Rife used light. Tesla used to treat with light very successfully. So, I mean, if you can, that's what acupuncture is all about, each of those little points. If you can test those with electroacuscope, or you can test the frequencies, and that tells you what food works for that organ. That's where it gets fun. So if you can take a concentrate of a certain substance without, most medications come from some plant in the past anyway. It's just they've tried to find the alkaloid that worked, and then they concentrated it and synthetically reproduced it. And you can't patent it because it's natural. So then they tweak it a little bit, and then that's where the side effect, if you want to call it side effect, comes in. And whereas just the regular plant is already taken care of. So anyway, that's kind of how I approach it. It's fascinating, and the response is very good. I mean, patients respond.
How do you determine the light, what frequency of light to use?
Okay, I've done it for so long now, I've pretty well got it all mapped out, but I have one machine, for example. I call it an AO scan. I wrote the brochure on it, and it's actually a Russian scanner is what it is. They developed it more for the space program, and it's based on sound, but just with headphones, and you can do it through Wi-Fi. That's why they used it, I think, for the space program. But they can actually challenge a tissue with a frequency, and it responds with a frequency, and they can tell if we'll say the liver is functioning at optimum. So too much or too little vibration equates to disease. So we'll say the frequency of, we'll just use a hepatocyte, for example, is going too slow. Then what he'll do is he'll hit it with a high frequency of the same, it's just a different octave, basically, is all it is. And it raises it up to where it should be when it's healthy. There are so many things, microwaving food, is a strange thing, because, you totally change the frequency of the food. Then the body has got to try to bring it back to cell resonance, or what it can use it at. And it's really, really difficult. So plus the fact that it's going to knock an electron off of oxygen, and then it becomes a free radical. So now it has to go find an extra electron. That makes it angry, and that makes it angry food. And unless you have enough antioxidants in your food, it can't do that. So the body can't use it very well. It'll do the best it can. It's just like using PUFAs. If you take a seed oil that's hydrogenated, the body will try to use it. It'll place it into that matrix of cell tissue, but it doesn't work very well. And if you take, say, a DHA or something like that, when you go to a restaurant, you know that they're going to feed you something cooked in soybean oil or something. You can take a fish oil, and the body will actually take that and use it in place of the other. But if you don't have something to replace it with, then you're just going to continue to degrade. So those frequencies are, it's color. If you look at just the 7 chakras, the Indian chakras, it's A, B, C, D, E, F, G. It's just that scale on the. So if you know middle C is 735 nanometers, then you know what the color is, you know what the frequency is, you know which acupuncture point it is, you know which food there is, and you can put that in a supplement form, and you can address that particular problem. So that's kind of how it works. I don't know if I made that totally confusing or not, but
Close to.
There's a lot out there been written on it. It's very fascinating.
Yes. Well, now you mentioned microwaving. What's the difference between microwaving and cooking on fire?
Well, cooking on fire, you're just agitating. You're going to increase the speed of the electron just by the heat. Whereas if you hit it with a electromagnetic frequency, that's a weapon. And you strike, say oxygen has 2 electrons in the outer shell, you knock one off. Now it was a nice guy. Now it's a very upset guy. And you take one of my shoes away, I'm upset. And I've got to go find somebody like my wife who has a lot more shoes than she needs. And that's an antioxidant. And then he settles back down again. But, that's why when the Germans invaded Russia, they found the microwave and they outlawed it. Many years it was outlawed. You couldn't have one in Russia because they knew what it did. And so there's a lot of microwave out there now. So we have to address that whole electromagnetic frequency issue now with our patients, especially if you run a blood test and say your TSH is low, and so is your total T4. Well, how come the pituitary is not telling the thyroid to produce more? The thyroid only produces 7% T4, excuse me, 97% T4. Yeah, no, excuse me, 93% T4, only 7% T3, the active form. So then it has to go, that's what T3 uptake is. It has to go to the liver. The liver's then going to add or break off an iodine and make it active. 60% of your thyroid's in the liver and 20% is in the gut. So you have to protect it. That's what fluoride does. Fluoride binds to the iodine receptor site in the thyroid. Very dangerous. Most reactive element on the chart. Number 9, it doesn't react with argon and helium because they're inactive, but it reacts with everything else. So you don't want to mess with some of those, and it's mostly a gas in there, but fluoride becomes very unhealthy. So we have to talk about those things too. So if you're
could iodine in your salt replace the fluoride in your thyroid?
Iodine is
Can it knock it off its little crown?
Fluoride will, yes, it'll take over the receptor. It's much more active than iodine.
Okay.
Yeah. And it's hard to get it off. And you can get all the iodine you want, won't do any good. Then if you have Hashimoto's or any antibodies that are attacking the thyroid, then you give iodine, you're going to activate it even more, and that makes it even worse. So that's why you have to diagnose it properly. So if your TPs or TPOs are elevated, then you have to not give iodine.
I have a question, Dr. Lafferty. Everything you're saying is so fascinating and interesting, and I really appreciate it. And I was wondering if you'd address the positive side of the plummeting health index.
The positive side is that we're having a major wake up. It's exciting to see the courage. There's some incredible doctors out there that are changing the whole parameter of healthcare. See, they're not happy with being paid and dictated to by a corporation. I mean, we saw this through this last little pandemic thing we went through. A lot of doctors knew how to treat this, but they didn't dare because they were under the control of an organization that's very powerful now. And that's because it wasn't stood up to back in the 90s. It was entertained, and then pretty soon it took over. That's why you have to be very careful. Kings are dangerous. So the positive is that we reap what we sow, and their system is about to fail. The wonderful thing is there's a whole lot of really good physicians that's just going to take up the slack. And I see in the future, even medical schools that are completely redone. So it's no longer indoctrination. It's actually true science-based education.
Thank you.
So, and people are waking up too. They just don't know where to go because they don't know what they're going to get when they ask. I hear it every day. I just had one. She came in and I looked at her blood, and she's got severe pernicious anemia. And she says, well, why did my doctor tell me anything about it or what to do about it? I says, I don't know. I can't judge your physician. I don't really know. But if you click on that, that guideline, it might not say anything because there's nothing to offer. There is to offer because it's folic acid and B12, but B12 is a tough one to absorb because it has to go through 3 steps to even get into the blood, whereas most of your B vitamins are just water soluble. So if you have an antibody, the second most common autoimmune disease I see in females is pernicious anemia, because we have an antibody that attacks the intrinsic factor in the stomach. That shuts the whole thing down. So the only way you can do it is either bypass it and inject it, unfortunately, they're injecting cyanocobalamin, which doesn't work with the dang. You got to stick with the methylated B12. But you can go sublingual, or you can find out what it is that's attacking the intrinsic factor. Once you find that out, you take that out of their diet. Then you can give them B12 and it'll work. And the zonulin gap in the small intestine that allows food into this blood before it's digested through the enterocyte is the problem. It goes right back to the gut again. And so you have a 10% function on the average person that comes through my office, and I've seen thousands, and they can't, the food is going to get into the blood before it's digested. The body does not want more than one brick at a time. It doesn't even want a dipeptide. It doesn't want putrescine, cadaverine, scatol, indole. It doesn't want any of those things. So if you get that in the blood, your immune system's going to react. Now the macrophage does first, your monocyte's going to elevate. But if you keep doing that and he can't handle it, he's going to call for TH2. He's going to call for the general. And he's going to bring in the Army, Navy, Marines, and the Air Force, and that's the autoimmune disease. So trying to find out what the trigger is, the food that triggered. Now I run lots of blood tests, and it's most often grains and milk products. So even if they can't afford to do those Cyrex tests, then we say, well, let's just go without for a month and see how you do. And almost invariably, they're going to improve. I get different ones. I just had a doctor, in fact, in from California. It was lettuce. Those are tough to find sometimes, but it all starts with a gut that allows something into the blood before it's digested. It needs to go through the enterocyte. The IgA is going to go to IgM to IgG. Injecting something directly into IgG is really kind of crazy because that's not where it stopped. The IgA and the IgM is where it's going to stop. So you have to heal the gut. And you heal the gut with fat, salt, of course, water and fiber, obviously, a good probiotic, and vitamin D. And you'll heal a gut. Unless you're just eating garbage, if you're drinking fructose drinks, or if you have a bad habit of drinking some other drink that's not good for you. Anything that's going to trigger insulin above 3.0 is going to cause inflammation, and you're never going to get the gut healthy. And there's some that won't do it. They just can't. They're too addicted to what they do. And I say, well, you're just not sick enough. Come back when you are, and we'll take care of it. But don't waste so much time. This body it's marvelous. I think it's God's greatest creation. I think he was showing off when he did it, but you got to take care of it. You just got to take care of it. So it'll treat you well. Now I made a lot of mistakes. We all do, of course. I don't have all the answers, but the things that I'm the best at are the things I had, so whether it's diabetes, whether it's BPH, whatever it is that you have, you figure it out. And I think that's a blessing because now you can help others. I realize it's not cookie cutter, one size fits all. That's the problem with guidelines that most physicians have to live by. You just can't do it that way. I think the interaction is critical. We're losing that interaction, but just have, just for someone to come in and you talk to them, they feel like you understand, you actually put your hand on that sore shoulder, they automatically start to heal. And that's unfortunately what's happening in the world of medicine. Physicians are losing that skill, and that's really a shame because there's great gifts there that need to be utilized for us to be successful. I think that's coming down the pike here pretty quick. I think you're going to see a huge failure where doctors and patients will say, we've had enough. It's time for a change. And I'd like to get back to the old days, like Dr. Guy. Dr. Guy is one I have, he was before my time, but in 1931, he believed that arthritis was infection. And so he believed that the best anti-infective was still chlorine. You know that because they preserved everything in salt. And so he injected a 1,500 part per million chlorine right into the blood. And he did, he says, I found out it worked better with a little bit of potassium. He noticed on his corn that his corn didn't do so well when potassium was low in the soil. It's funny how the agricultural world kind of teaches us healthcare. So he started injecting from 500 to 1,500 parts per million, and he had tremendous success. And so he said, Big Pharma showed up at his doorstep and said, if you'll quit doing this and not publish your findings, we'll take care of you for life. And that's the problem. And so people like Dr. Guy stood up and says, it's not going to happen here. So his house was burned down, his pharmacy was burned down. You know, he was compounding his own formulas. And after that, the only thing he could make was hydrochloric acid, triethylamine. So he just started making those and he injected every person that walked in his door. He said, it's the only thing I had. And they wanted something, so I just injected them with hydrochloric acid. Very dilute, they call him a quack. But then he published his findings, which was interesting, because tuberculosis was killed 1 out of 7 on planet Earth. He cured 100% of tuberculosis just by injecting chlorine. Lost about 29,000 women that year to childbed disease, and he says, just inject them. And one of his colleagues says, well, I'm going to make sure she's about dead before I do. And so he went to visit someone, she'd had a baby and she was in a coma, was obviously going to die. He injected her and said within 20 minutes, she was talking to him. See, we need more like that because they know it works. That's science-based, not evidence-based. It's not tainted. That's autodidact. That's experience. That's a guy that maybe didn't go to school, but he'd been building houses for 40 years. He knows what he's doing. And I take that over a diploma any day. So education is important. I understand that, you know, but like a friend of mine, associate of mine said, says it took me 10 years to get a PhD at Berkeley, and it's taken me about 20 years to get over it. So it's life. It's a person that is interested in the health of others, and you'll get intuition that comes as this happens. And whatever your skill is, whatever your interest is, it'll blossom. It'll just blossom. And that's what I believe. So that's the positive side, that it's causing awakening, and it always does. So we go through these cycles, but we need to wake up because it's really kind of corrupt out there, for lack of a better word, just corrupt. You know, what happened to first do no harm? You know, I mean, abortions, castrating children. I mean, it's beyond me. So we need to do what's right. We need to just be good good people and do what we're supposed to do. And we know what's in our heart of hearts, what we should do. And quit taking advantage of others and just serve others. And it works out very well. So I don't know if that answers your question or not, but anyway, that's my belief system for whatever it is. And I just think I think we got some really good things coming after we get through a tight spot.
It does answer my question, and thank you. And it seems that people are turning to, you know, complementary therapies, but things that really can route out problems and heal. But the other way is so strong and powerful. And you know, I just know a handful of people who think like I do, and everybody else is marching along with the system.
There's more than you think that just don't dare say anything, and they just need a leader. They just need somebody to stand up. Everybody needs a general, and they collect to that general when that happens. And we're starting to see that happen. I see a lot more than you realize that is happening that is good. Now, I realize the media is poisoning a lot of people, and you can't watch something all day and not be poisoned. You just can't think straight. So you have to get away from that. And as you get away from that, then it all goes away, and you wondered how you thought that way in the first place. So, but metaphorically, I read the last chapter, and it turns out really good. So
Takes us a while to get there, right?
takes a while to get there. Yeah, it takes pain to get to the good part. Yep.
Thank you, Dr. Lafferty. We're enjoying your presentation very much. Can you please tell us what you recommend for the best avenue to keep ourselves hydrated? What do you recommend for that?
So we start just basically with, don't use municipal water. It's got to be clean. It's got to be filtered. When you look at things like atrazine and glyphosate and things that's in our groundwater now, it's very, very poisonous. Atrazine, probably the worst. You know, it was developed in Switzerland, and the European Union outlawed it So they can't even spray it over there. So they ship it to the United States, and we spray it handily on corn and cotton and lots of foods we spray it on. And we even spray it on, well, they actually hired a doctor at Berkeley to study atrazine to see if it was actually safe, like they said it was. And he spent 10 years in that research and came out and said, he called it the great feminizer. Because when he exposed frogs to it, they developed both male and female characteristics. And males were delivering and mating with other males. So that's what atrazine is for you. And it's in all the groundwater. You can test any water and find it. So you can't afford to shower or drink municipal water. You just can't. It's just too toxic. So you need some sort of filtration of some kind. You know, the aromatic hydrocarbons are easy to take out. You can use a charcoal filter or something for that. But if you want a whole house system, you have to get a little bit more involved. I've tried a bunch of different systems. I've tested them. They work very well. Probably the least for the money. See, the company's in Texas. It's called Essential Water and Air. Man by the name of Fred Van who owns that company. And they have a good whole house system that you're going to spend about $3,000 or so for your house, but at least every tap is clean. And I've tried about every system out there. I've got one here in my office that's probably 20,000. And there could be a dead skunk outside in that line that wouldn't come through my sinks. So you have to clean it up at least a little bit. We have inexpensive shower heads that are like $40. And some people, that's where they start. They just unhook theirs and put this one on. They catch that water. It's as good as bottled water without all the plastic going into your system. And at least you can get rid of chlorine and a few of those. You're not going to get rid of fluoride or heavy metals or anything like that. You have to get a good system for that. But half your body weight in ounces is what we consider, if you're healthy, that's good enough. You have one shot at a big amount of water. That's when you first wake up. So I'll drink a quart of water when I wake up, because you're very dehydrated when you wake up. And I'll put about a half a teaspoon of unrefined, unheated salt in that. And that will allow you to hydrate, because it's the adrenals that allow you to hydrate. And if you want to, you know, if you want your antidiuretic hormone to kick in, you have to put a little salt in the water. Otherwise, you're going to be urinating all night. So vasopressin, you know, the opposite of that, which is arginine vasopressin, is going to activate. So with your salt, you can hydrate much better. So say you weigh 100 pounds, you want to get at least 50 ounces between meals. And the first dose is a big one. And then after that, it's 4 to 6 ounces. So you don't have to run to the bathroom all the time. At least a half hour away from a meal. You don't want to dilute your digestive enzymes. But Dr. Batmanjeli, if I say his name right, that did the study when he was in prison under Saddam Hussein. He had nothing to work with but water. And so he just did water research in a highly stressful environment. So disease surfaced a lot faster in that environment, because they'd call your name on Thursday and execute you. And so he started doing just water studies and he did quite a bit. He eventually went to Great Britain and ended up at the University of Pennsylvania, I think, and finished his 10-year study on water. And then he approached his profession, and he's a medical doctor, and said we could reduce our healthcare costs in half just by hydrating everyone. And they weren't the least bit interested. And you can understand why. That's not the physicians, that's corporations. So anyway, I say just have it in front of you, because if it's by you, then you'll sip it. Otherwise, you'll forget what you did. And I always have mine in my office or wherever I'm working. I got one there, and I know by lunch, this has got to be gone. And between lunch and dinner, I don't drink after dinner, but just sip it. It goes away very fast if you just take a swallow or two. And then just adequately salt. You know, the average adult needs at least 1.5 teaspoons of unrefined salt. You got 72 minerals in there. I use, it's interesting, again, back to the electromagnetic world. The head is more positive than the feet. The right side is more positive than the left, and the front is more positive than the back. That's why if you sleep with your head to the south, you sleep better than your head to the north, because you're putting two north poles together. So head to the south works better. So when I take minerals, for example, I have Antarctic minerals from the South Pole, you get this spin that strengthens just 1/2 of the body. So then I have to go get it from the North Pole. So I put 2 drops of each in my drinking water, and that's how you can actually regulate that. It really upregulates, it's your battery, it's your ATP. So you just feel a lot better if you do that. So Salt in your water is the key. And, you know, unless it's contraindicated, I mean, if it's essential hypertension, that's one thing, but non-essential is 98% of the time. And in fact, I got a book over there in my library on a doctor that just treats high blood pressure with salt. So when you refine it, the first thing they do is take out potassium, your primary intracellular electrolyte, and all you have is sodium chloride. Now no wonder that gives you a problem. You get a preponderance of extracellular sodium. That's not good for you. But the chloride in salt is how the body makes hydrochloric acid. It takes the hydrogen from water. So when it puts it together, that's why you can cure, you know, reflux, you can cure, you know, heartburn just with proper hydration of salt. And that's what Dr. Blvd said. He says most ulcers and reflux and gastritis comes from dehydration, because he was curing them all the time just by making them drink water. So yeah, if you're ever thirsty when you're eating, you didn't drink enough an hour before, because you shouldn't be thirsty at all. So I don't know if you've noticed in Europe or not, but when you order food, they bring it out, you have to ask for water. And if you do, they know you're an American. So anyway, that's kind of water. And water just works better than anything. Our body, you know, we're born at 80% water, we die at about 40%. So you want to stay hydrated. It's very important. And it's easy to do, but just don't drink something out of that tap. You know, you're asking for all kinds of trouble. I had a gentleman come in, this was a couple of years ago. He had severe skin cancer on his face, and they were treating him with steroids and stuff, so forth, the traditional guideline, with no success. And I just asked him, are you showering in municipal water? And he says, well, sure I am. And I says, well, just take this shower head, and each shower, when you shower, just stand there for 5 minutes, let it run on your face. Now, the shower head I gave him was an expensive one. It was like $250. It wasn't this $40 one. And so he did that. He come back 1 month later, his face was as clear as clear. It was all completely gone. So I had one today with severe acne on his back. And just by putting that cheap shower head up, he says it cleared up my acne. People are flushing a lot of stuff down the toilet. They don't take it out. They just bleach it. So you don't see what it looks like. It's filthy. Sometimes I used to do a little demonstration from an outside tap. I take 2 cups and I put chlorine drops in one. It turns it yellow. If there's chlorine, it shows you it is. I'd have them put their finger in the other one and count to 5 and take it out. And then we put the drops in and there's no chlorine. So the body's already absorbed it. It's just really, really hard. The skin is more absorbent than the gut is. The gut is more protective than the skin is. I'd rather drink chlorine than shower in it. So we just need to do what we can to clean up the water. It's really unfortunate, but I heard, was on the radio, so it had to be true, but it was probably 20 years ago, is where they said 50%, and they were talking about our state here in Utah, 50% of our municipal water did not meet minimum safety standards. All the deodorants they put in and all the bleaching agents is really unfortunate. You got to get good water. The free things work the best. You know, if you learn how to breathe and drink your water and get sunshine and put your feet on the grass and, you know, salt your food and do stuff like that. That's all good health. Increase your fat, you know, just do opposite of what you're told. And, you know, I mean, I've cut enough arteries open to know that it's not fat that blocks it. Okay, CAC is the test we do, the cardiac arterial calcification, and it's always calcium. It's hard water deposits. It's a scab that's responding to inflammation, and you can change all that. You know, that's why we add K2 to the vitamin D3, because D3 is going to pull up the phosphates, but it's going to fill your blood with a lot of calcium, and you don't want it to stay there. You know, you want the osteocalcin in the osteoblast to be carboxylated with meninquinone 7, that's MK7, vitamin K2. And then it pulls it all from the blood into the bones and teeth. So in Japan, they inject vitamin K2 for osteoporosis and bring bone density back. Instead of using some medication that's going to make your bones hard, that's no answer. You don't want hard bones. You want flexible, strong bones. So, yeah, and of course, vitamin K2 is rich in fermented foods. So, you know, drink your pickle juice and your sauerkraut and your kimchi. And that's all got a lot of vitamin K2 in it. Anything that's fermented has K2. So our diet doesn't include as much K2 or as much fermented food as the pioneers. They had no refrigeration, so everything was fermented. Grandpa stuck his milk out there. I still see him doing that in the screen porch until it clabbered before he even ate it, because it was already digested. They never got any distress from that, and they just got used to that. He put a little honey on it, but anyway, that's how you hydrate. Okay.
Thank you very much. We appreciate that.
You bet. You bet.
How about a recommendation for adrenal insufficiency?
Adrenal needs 4 things primarily. Okay, now any kind of stress is going to obviously make the adrenal less functional. That could be a bad back. That could be a divorce. That could be sugar. You know, alcohol, tobacco, caffeine, and sugar are the biggest detriment to adrenal health. So as far as the world of what we intake, you know, and so you need to avoid those for sure. But salt is by far number 1 for adrenals. Number 2 is B vitamins. You know, all methylated B vitamins preferably, so they're easily absorbed. Number 3 is just magnesium. Magnesium, the adrenals use a ton of magnesium. So when a person is suffering from anxiety or panic attacks, that's what we give them. Vitamin C is the 4th, but it's hard to get a good vitamin C because the ascorbate doesn't work. You have to use a food base like camu camu or moringa or something like that that's got vitamin C in it. So the one product I have called Stress, that's what it is. It's for adrenal exhaustion. That's the one we use for, you know, a person that's got adrenal. And, you know, Hans Selye said 50% of people are walking around at least 2nd stage of adrenal exhaustion. So it's probably worse now. It's a stressful world out there unless you fish or golf or do something fun. I do both.
Your product Stress, is that from a company, or is it just a combination? Or
It's my company, and I made the company is called Matrix Formulations, or MTX Formulations for short. So mtxformulations.com is where it's at. And I think I put a description of everything on there, but maybe not. They're yelling at me all the time because I'm more busy in formulating, putting things together at work for things than I am trying to take care of a website. So our website is probably not that great, but at least they're on there. I think they just told me today I don't have a description for my spine product, the one that we use to rehabilitate musculoskeletal. So I'll add that description. I just put a simple description on there, but you can see the.
yeah, it's MPX Formulations. We lost you.
We just slow the machine down. Makes it more expensive because they can't run 60,000 bottles an hour. But if I can't make something better than what's available, I'm not going to do it. So that's just one of the many I have on there. Well, I have about 20 on there.
We missed about 30 seconds of that. We had a little.
Oh,
We had a little
okay.
freeze there. So
okay, you should be able to see ingredients. You should be able to see on that website what's in it and what is involved. And just, you'll notice that it's all clean. I go to great, you know, efforts. You look at the high performance blend, which they affectionately call cowboy powder. I did that for the PRCA. And that one under other ingredients, it says none. You know, I haven't done it. There's no artificial sweeteners, no caffeine, none of that stuff. I see what's being sold even in health food stores, and it's just criminal, I think.
it's mpxformulations.com. Is that
TX.
MPX?
Yeah, Matrix. That's short for matrixformulations.com.
Okay. Okay, and the Dr. Momo asks about filters. Were there certain filters you recommend?
For water, you talking, what kind of filters are we talking about?
That's all she wrote was which filters do you recommend? So
Let's see.
Yes, for water, for the shower and water.
Okay, the one that I get that's like a $40 one, it's I get that through Premier Research Laboratories. It's an inexpensive filter, and it works. It's a good starting point for, especially for people that are renting or kids that are in school and that sort of thing. I always throw it in my suitcase when I go anywhere, and I take a little channel lock, you know, make sure it's under 7 inches, or they'll take it away from you. And I just unscrew theirs and put mine on, so I don't have to shower in yellow LA water. So that one is the best. If you want to go to a more involved one, it'll take more things out. It'll treat it with things like infrared magnets to break up the argonite crystals. I would go with Essential Water and Air. eWater, I think, .com is what that one is, eWater. And I've used theirs for a long time. They do a good job. and that's a more expensive shower head. If you want to get into house filtration, then you're going to move into like reverse osmosis, for example, which then you're going to pay $600 or $700, but that's only going to be for drinking and cooking. You can't do enough. It takes about 10 gallons of water to make one, so you're not going to have enough to bathe in. So to get a whole house system, I use e-water again. There's another company I've used for the one downstairs in my office here, but that's a really expensive one. So if you want to burn some money, I'll give you that one. But if you want to spend in the neighborhood of $3,000 to $4,000, depending on how big your house is, I think Essential Water and Air is as good a one as you're going to get. They do a good job.
Okay. Anybody else have any other, there's no other questions in the chat. Anybody else have any questions?
I had a question about well water. I know that the well water in our area has arsenic in it and also nitrates because we're in a farming area, and potentially sulfates. And I'm wondering how those, I know that some of them can be carcinogenic. I don't think the arsenic is enough to actually kill someone, but it can't be healthy for you.
So when you have someone build a filtration system like e-water and air, Essential Water and Air, you just want to tell them what your concerns are, and they'll make sure that whatever they build is capable of taking that out.
Okay,
I
thank
don't
you.
build filters. If for some reason they say, well, we can't get arsenic out, or I'm sure you have atrazine. If you got atrazine or glyphosate, if you've got those even in well water because you're in an agricultural area, mining and agriculture is the biggest polluter of underground water. So yeah, I'm sure you have other things. If you send it to an ag college or something like that, they'll tell you what's in there. If that's unsatisfactory for you, then let me know and I'll give you another alternative. It's just a lot more expensive, but it will clean it up.
Yeah. What was the name of that filter again? You said the inexpensive one, the Premier something
Premier,
lab.
that's PRL.com, premierresearchlaboratories.com.
Okay.
They have
Okay.
filters, and that's the one that's like, I don't know, $45 or something like that. In that neighborhood.
Okay. All right.
It works good. And then once you just unscrew it and place a $20 filter replacement in there. It's very simple to do. It works really good for travel for me. I use it all the time. I get stopped in the airport all the time. They think it's a bomb or something, and it's a filter. It's in the box. I don't know how you can mistake it, but anyway, I pull it out now and just throw it in with my shoes, so they can look at it and not have to open my suitcase and stare at it all the time. They had a whole circle of people standing around it the other day, and they were staring at it. They had gloves on. I don't know what they were thinking, but they called for the head guy to come down and look at it. And I'm standing there. They called me down from the gate. I came back down, and the head guy walks up in his suit and he looks down. They says, "We don't know what this is." And he says, "Looks like a shower head to me." And he turned around and walked off. Anyway, that's the only problem. If you're going to take in your suitcase, maybe because it's round, whatever. I think it's kind of crazy, but whatever.
Okay.
It
Thank
works
you.
well. It works well, and you can just catch that water and use it like bottled water, because bottled water is mostly toilet water anyway. But there's a couple of them that test pretty good. Arrowhead tested pretty good.
What about a rain barrel? I've considered that.
Well, rain barrel is a great idea. It's kind of funny that the government says you can't collect more than so many gallons, which, if they could control the air, they would do that too. But
Oh, well, they'd have to catch me first. I'm way out in the country.
oh, okay. Yeah, that's a great idea. Great idea. No, I think that's a great way. But then you need to use some filtration. There's some really good filters out there. Catadine is a good one. The military uses catadine. That's a ceramic. You have water filtration, and you have water disinfection, where they're going to use iodine or
Yeah.
something.
Yeah.
So
What about using UVC light? I know that in some third world countries they do that.
yes, I mean, I have one on all my systems. So after it goes through all the water filtration, it goes through a UV light. Yeah. So if there's something happened to sneak through there somehow, the UV would be a good alternative. So yeah, I think that's a good choice.
Okay.
They
Thank you
did
very
burn it out. I put his timer on it because those bulbs are expensive, and there's no reason for it to run all night. So just set one of those little cheap timers and let it turn off at night while you're sleeping and then turn back on in the morning. Then you'll get it to last
Yeah.
low. But no, it's a good choice.
Okay.
Electromagnetic frequencies, we didn't say too much about, but there's a lot of things we need to do to control that. It's just, I just built a new home and I just put in Ethernet, and in the construction materials, which I tested at every level as they were building it, just to see if I could stop electromagnetic frequencies. I could. I had to use shungite, which is a Russian meteor. That one does a great job. It's a fullerene, a 60 carbon chain circle. You can look those up and they're kind of fun to look at. It looks kind of like the Epcot Center. And that's a North Pole stone. And then I had to find something to take care of the south side, which was in India. And then Narkamata River, that's the Shiva Linga, another meteor. It absorbs EMF really well. So I just put it right in the building materials, but you don't have to. You can set it in your house or sprinkle it around in your yard if you want. And then just put a timer on the Wi-Fi. And with Ethernet, you can plug directly into it. You don't have to worry about the Wi-Fi in your home. And of course, testing the smart meters, I have meters to check all that stuff. And there's ways to block all that. We got a Faraday cage that we slip over top of that and it'll take 92% out. And you make a much healthier home than being bombarded by all this darn stuff. And then for heck's sakes, turn your phone off. So
Yes.
some people say, oh, I use it for an alarm. Well, get an alarm clock or turn it on airplane mode and use it as an alarm if you want. But it's very dangerous. It's very harmful. It makes a lot of people very sick. So if your immune system's already compromised and you're challenging it with electromagnetic frequencies and these darn Star Trek towers that are 5G now, I would never mess with 5G if I could get away from it. There's a way to fix it. I've treated a lot of them and we've gone and we've tested them. It works pretty good, but there's only so much you can do. So.
What are you doing for my son is being affected by the what is it, 5, whatever it is,
5G.
the 5G, yes. And he has also seen many patients who've been affected by it. He lives in Chicago,
Yes.
where they probably have a bazillion of them.
Yeah, that's really, really bad. The 5G is a small one. You don't necessarily see it. They have to be every couple hundred feet all through the city. So yeah, it's well, there's multiple things you can do, but you can protect at least your living and your working environment. I did a big one up in San Francisco, and I did one of the products on that website is called EMF Guard. I found 5 different ingredients, 4 plants and 1 ingredient that actually did a really good job of blocking EMF. And so I just call it EMF Guard. That's one thing you can do internally. With pilots that are flying and they're getting really slugged pretty good, we have a fermented green tea. It's a liquid. Have them take a teaspoon every day. That is a very, very powerful antioxidant. When the bomb was dropped on Nagasaki and Hiroshima, there was a group of Japanese that didn't get any illness at all. And the government did a study on it. They had to sue the government a whole bunch to get the answers, but they were consuming green tea and miso, both very, very strong electron donors. So when you ferment green tea, there's no caffeine or anything. You're just after the epigallocatechin gallate, the EGCGs. And it's strong enough that if you're going for radiation therapy and you took it, it would stop the radiation therapy. So that's how strong it is. So that's a good one to take, the EMF Guard, like I said, and then just in an environment where, say, you're working where they're around computers and stuff. I have shungite sitting here. It's just very absorbing, and we have it in pyramids and cubes and eggs, and you can order it. It takes about a month to get it from Russia, but and then I carry them. So I even got a Shiva Linga on my keychain right there.
Okay.
And they're all shaped like that. They roll down that river and they collect them in the fall when the water's low. I've got a 27-pounder in my house. So they're kind of cool to look at. But when we have somebody that's really in a high environment, we actually take the shungite, which comes in different grades. You have grade 1s, 2s, and the ones that are 98% carbon are very, very absorbent. And it comes kind of they're broken up. And I have them just sprinkle them on the north side of their building, preferably in dirt, not on concrete.
Mhm.
And it does an amazing job of clearing. I've tested a lot of those. And then on the south side, we use the Shiva lingas.
Okay, so south is Shiva lingas.
Yeah, so if you wore them in your pockets, if I go to my left pocket, I have shungite. Now shungite is black, like this. And
Okay.
because black has an L in it, you can always remember that's the left side.
Okay,
Shivas are brown. There's an R in it. I tell them right. I said, don't get that mixed up. It'll mess you up.
yeah, yeah.
Then about once a week, you just throw them on the ground. If you throw them on the ground, they'll recharge again. Just only takes a couple of minutes because they get filled, they just need to be recharged. So it's just some cheap, inexpensive ways to make a huge difference. And I see patients coming in with these bracelet or these little watches, that get Bluetooth or whatever the heck they're doing. And when I'm testing a Pons pollicus or any of the extensor muscles, they're always weak. And I said, take that thing off, and it goes strong again. So it's really compromising.
Mhm.
So if it's that important to be in touch with everybody on your wrist, I don't understand that. But whatever it takes,
Mhm.
it's not good for your health. Anyway,
Yeah.
we've treated everything, with that as best as we can. It's very strong. And it used to be I could use even magnetite worked, but not anymore. So you have to use
Mhm.
stronger ones. But shungite's very strong. Shiva lingas are very strong, and they work very well. Make people feel a lot better. I just did I do some of the police cars and the highway patrolman. He come in and was all upset because of all the EMF in his vehicles making him crazy. And, you don't want to get a highway patrolman mad. He's already mad, but so we just treat that. And I even treat some of the electronics. We just use, we have these rolls of, it's just lead tape that's sticky on the back. And we'll take a piece and just put that right on the back where the battery is, and then cover it with gaffer's tape, and then let them put their cover back on so they're not exposing lead. But, just like in my X-ray room, it absorbs very well. So just some things like that you can do that are pretty significant for people that are sensitive.
Okay, thank you.
Uh-huh.
Okay. Dr. Burgess, you have any words of wisdom for us? Are you there?
No, but I'm just, oops, here I am. No words of wisdom, but I'm so comfortably blown away and thankful by the common sense truth you're sharing with us. So thank you, Dr. Lafferty.
Thank you very much.
It's fantastic to hear. It's fantastic to hear some common sense stuff where we've been missing it for about 50 or 100 years.
I agree. But the world's waking up, and that's the exciting part. That's the positive side of a plummeting health system.
Your hope is encouraging. I thank you for that too.
Well, I have absolute confidence. So yeah, good always prevails. Darkness always fails. So, it's just the way it is. So just live a life that you know is correct, and it'll all pay rich dividends for you. And our
Right.
heart of hearts, we know what that is.
Dr. Burgess, we'll have to hang on to that, right?
You got it.
Okay. Anybody else have any questions or like to chime in here? Lots of thank yous, lots of kudos. Thank you so much for sharing this time with us.
Thank you for inviting me. I appreciate it.
And I don't know if Dr. Nakarada's told you, our group's been through some issues ourselves, so we can relate, to this. So, anybody else, any comments, questions? Mr. Hartman's not on tonight. Any follow up from last week? Now, you don't notice, Dr. Lafferty, we were invited to participate in a sort of a community grassroots research project.
Is that already taken place, or is that still going to?
It's still going. No, yeah, it's an ongoing.
And you said that was about BPH or something like that, if I remember right?
Yeah, it's ongoing.
Okay.
And
yes, I'm very interested in that. I'm very interested in that.
yeah, so I put it in the email if anybody wants information on it. I gave you the links. And I'll keep it going for the next few weeks at least and see where that leads us. They're an interesting group, and it's worldwide. It's run by that Mr. Gonzalez who spoke last week. He's the sort of the head, him and Stephen Hartman, who's not here tonight, but he's one of our guys. Have been running that. They have over 1,000 people involved. So
Great, that's great. Yeah, I'd love to get any kind of information like that. It helps me.
yeah, I found some of the literature on it, and there's good evidence-based literature on it. It's not just stuff two guys made up. So
That's good.
we'll keep
That would be science-based, not evidence-based.
yeah. Yeah, well, we're clinging by our fingertips to the AOA model. So
Well, it's nice to know that, and I own a 4, of course,
Mhm.
zinc is always important in health of prostate, and the
Mhm.
ion can, of course, allow that uptake into the mitochondria. So I can see where that would work. I don't understand the other part you were talking about though. But I'm
So-
interested to see what that's all about.
yeah, so maybe we'll have an update. We'll have some a bit more information from. Like I said, I read some of the literature myself, and it was pretty interesting. So.
Love to read it.
And so we're involved with that. Dr. Burgess, you were our point man at OMED. So OMED is the AOA's scientific conference that was last weekend.
Yeah.
that we were unceremoniously booted out of. So
We're okay.
so Dr. Burgess was our spy there. So
Yeah, we did well. Dr. Lafferty, you appreciate out of about 300 lectures, there may have been 2 to 5 that we would have found within the naturopathic, acupuncture,
I see.
homeopathic model. Out of 300, maybe 5 within that realm. And it's a lot of it's lip service. So what I found out at this meeting is that we're all just in our common little group way ahead of the game.
Sure, that's great. Well, Gideon took on all the Amorites, and he said there was numerous as grasshoppers, and we know who won that battle. So it's not in numbers; it's in truth.
I'm keeping the faith.
Good. You need to, because it's going to work.
okay. 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 Any other question, John? You want to? I'm going to see if I can find that link real quick. If you want to just talk to folks for a minute here, and I'll see what I can do about finding the link. Okay. So I'm getting some questions about it. Here it is, actually, right here. So here's that. So we'll stop the share and we'll go back here. And this will be for everybody. This was the link for, that's the link for the research project. If you want that, it's in the chat, and it was in our email, if you got our email, and the video from last week, if you're interested in that, is also, it's on our website, and it's right there, and it's also on our AOSRD website, AOSRD.org/webinars, is where you'll be next by this time on Thursday night, Dr. Lafferty. So, okay. So that's the video there, the Vimeo video for the talk from last week, and it's also on AOSRD.org/webinars. It would be great if we could get, be part of those, a good presence as part of this, if you're interested, obviously.
Definitely.
And yeah. So are you on if anybody that's on our email list that was in this week's email, all those links. I don't know, are you on our email list, Dr. Lafferty? I'm not sure if you are.
Yes, I clicked in and I'm getting it
Okay.
now.
All right, okay, so it's there, okay, so that, anybody have any other comments, questions? Any final thoughts, Dr. Lafferty, summary, that kind of thing?
I was listening to a doctor lecture the other day, Dr. let's see, Amerling, I think his name is Amerlang, if I remember right. And he just wrote a book called The Next Wave is Brave. And I was listening to him talk. He sounded like me. So I thought, hey, there's another crazy one out there. But anyway, he's one that you would definitely get some really good information from and give you some hope and courage what's coming.
Okay. All right. Yep. We need a little bit of hope and courage, right, John?
You got it.
Yeah,
Okay.
that'll be a good one.
Okay. Next week we have Dr. Andrew Kostunek. I think that's how I pronounce it. K-O-U. Hang on. I had it. I tried to get it right and I messed it up. Koutink, who's a researcher and a nutritionist. So he'll be with us next week.
Great.
As we said, everybody, sorry about that. Before we sign up, I got to get that. Okay. Any comments, questions? Anybody that wants to present, please let me know. Holiday season's coming up, so we'll be here no matter what. Tuesday nights, 5 o'clock Pacific, 8 o'clock Eastern. And, we're starting to attract some around the world. Dr. Boyle's here, I think, is not in the US. We had quite a crowd last week also. So we did pretty well tonight. Any comments, questions, criticisms? If not, final word, Dr. Lafferty?
I'll just hang in there. It's going to be
Just-
good. I read the last chapter.
Not like remember the movie, The Graduate? What was the word? Plastics, right? Remember? Not plastics. Okay.
Thank you much.
Okay, thank you so much, everybody. Okay, we'll see you next week, same time, same station. John, keep up the good fight, and we'll talk to everybody real soon. Okay,
All right. Thank you.
thank you so much.
Okay, thank you, all of you.